Yeah.
Okay. Right.
Thank you so much for having us.
Hi, and welcome to the Upgrade Healthcare interview series, where we aim to create a more informed healthcare consumer. And I am your host, Dr. Bhavana Rao, founder physician of Meridian Springs Primary Care. We are a direct primary care based model primary care clinic where we offer a flat monthly fee, unlimited visits, no co-pays or visit fees for any of our members. We also include telemedicine. I'm joined by Sunil, who is our marketing and business development lead.
Hi.
And we have today with us a very special guest, Mr. Nathan Ude, and Udi, and and Heather Eden. Nathan Udi is the CEO of Zion Health, and Heather Eden is director of account management, who is here to discuss more about health sharing. Hi, Nathan and Heather.
Hello.
Hi.
Thanks for having us aboard, and we're excited to talk to you guys a little more about Zion Health and also how to be able to incorporate that as part of the practice with the clinic as well.
We are super excited about this discussion. Now, the main, of course, we want to know all about health sharing and how health sharing is different from health insurance.
Perfect. I'll take that question. So the difference between health sharing and health insurance is really that we're a community. We help share in each other's medical burdens, and we're really just that model of like-minded people coming together to share in one another's health burdens. So they will pay their membership fee. It comes into a community fund, and then when someone has a large medical expense, then funds are withdrawn from that community fund and shared in for that need. So really kind of the way you think health insurance should be, but better.
So is there any eligibility requirements, any enrollment period? Is it available throughout the year? How does that work?
So you can enroll with Zion Health at any time. We're open to everyone. We accept everyone. We just want to make sure we're a good fit. We are able to limit on how we share in pre-existing conditions. So we want to make sure that we're a right fit for our members, but we do accept everyone. So everyone of every faith is available to join us. We accept all faiths. So there's no need for a statement of faith to join our community.
Yeah, that was actually my question. The next question was, usually when people think of health sharing, it's more associated with some kind of a belief or faith. But is there a set of beliefs that that you need to have to be part of Zion, even though it's not faith?
No, yeah. So I'll take this one. So the community is we believe in a higher power, but there's no requirement that you have to have that specific faith base. So if you have any religious affiliation, there's not a requirement that you have to have one faith or another. You could join us as a community that is believing in that we could share in each other's medical expenses and do it better by doing it this way.
Great.
Yeah.
Awesome. So this is a big change from the previous health sharing plans we have had. Now, do you have networks like insurance models have in networks and out of networks? Is that something that's in Zion too?
So we allow you to use any provider that you like. So if you have a specific hospital that's nearby, or a provider a specialist that you need to see that's outside the clinic, then you'd be able to see anybody that you need to. We do have preventative services that would require a network, but if you were to see a hospital, or if you have like a broken arm, or if you need to have emergency room visit, anything that you would have happen to you in a case of specialists or having to go into a hospital, surgical centers, for example, you'd be able to go to any place that you like.
So I know with insurance, there's within the state lines, across the state lines, is there anything like that with Zion membership?
Well, Zion Health is able to share in medical expenses across the country. We have members in all 50 states, and actually and also the U.S. territories as well. So we are able to help people regardless of where they are. And why that's important to a clinic in the Texas area, for example, is that if you needed to see a specialist, or if you were out traveling, we'd be able to share in those medical expenses regardless of where you are. We also even could share in medical expenses all over the country too. So if you're, I'm sorry, all over the world, I meant to say. So if you're traveling into a different country and you had something that came up and you needed medical attention while you're traveling, we'd be able to share in those medical expenses all over the world.
Okay. So in the insurance, you have co-pays, deductibles, co-insurance. Is there anything comparative to that in health sharing?
Yeah, so we have a what we call an IUA, and an IUA is a initial unshareable amount. And the Design Health community believes in personal responsibility, and so what this means is that if you have medical expenses that you have that are smaller, for example, or the first part of a medical expense, instead of having it from $1 shared with the community, what you're doing is you have that personal responsibility that you pay for those medical expenses out of pocket. And then after that, once that IUA is met, or the initial unshareable amount is met, we would share in that medical expense 100%. And that does not, one of the benefits of this type of model is it doesn't roll over, it rolls over from year to year. So to give you a little example, what this means is if you were diagnosed with something like cancer, which is terrible to have, of course, but if you have that, like I've had it when I was younger, when it took years to get better, and there's oftentimes treatment that lasts for 2-3 years or even longer sometimes. And so when you go through this type of medical expense, instead of having to pay that IUA again over and over every year like a deductible would be, you're just paying that initial shareable amount for the first time, the first part of that expense. And then as long as you're getting that care, you are able to continue getting that sharing with the community taking place without having to repay that deductible like a deductible would be, but we'd have that IUA instead. So it's really member focused, really helping those who have those larger medical expenses, making it easier and better for our members.
And that IUA is per incident, correct?
It is. Yeah, so our IUA is per incident, and we do also have limitations of how many IUAs you pay in a 12-month rolling period. So you're not having to pay over and over and over. It's kind of like similar to what you might see in the insurance world. You see an out-of-pocket max. We don't have what we call an out-of-pocket max, but we do have a limitation on how many times you'd have to pay your responsibility to your medical expenses in a 12-month rolling period, which is 3 times in a family. And so if you're by yourself or as a family, you're only having to pay up to 3. And by the way, just to kind of elaborate a little bit further, is that we have 3 different IUA options. You could choose either 1,000, 2,500, or 5,000. So you have a choice depending on what's right for you.
Really keeping it simple with those 3 options. If there's that 4th medical need in that same 12-month rolling period, so it's going to start, that period is going to start at the first medical need and be 12 months from there. So the most a member could expect to pay would be 3 times their IUA amount in a 12-month period. If there happens to be a 4th one, it's a catastrophic year, we wouldn't ask for that IUA the 4th time. We would just simply share in the medical expenses as long as they came to 500 or more. And something else I would elaborate on as well is we also have what we have we're calling a quality incentive and pricing incentive. If we know there's an upcoming surgery and we're able to approve that and schedule that ahead of time, we have a program where we're able to waive up to 50% of that IUA. So we feel like it's a win-win-win for everyone. Win for the provider's paid ahead of time. The patient, the member is confident that their surgery is going to happen. They just have to worry about surgery on surgery day, and then we're able to save money for the community overall. So it's a win-win-win there with the IUA.
Love that program.
Are there any maximum limits to what is going to be paid per claim?
No. So one of the benefits of Zion Health is that there's not an annual max or lifetime maximum of how much we will share as a community. So, like, for example, I know some communities or some organizations, even insurance, some companies have limits of maybe $1 million or $2 million, where we don't have that limitation.
Awesome. This is really very helpful information. Now, we also want to know what are the benefits when somebody pairs Zion Health with direct primary care clinics?
That's a great question.
I'll be happy to take this one. I love you guys. I love DPC providers. You guys, when you sign up for a DPC program and you pair it with Zion Health, you're going to get a complete whole healthcare package. The DPC is awesome. They're going to build that relationship with you one-on-one. You're going to enjoy 1 hour visits, usually with your members, telemedicine visit like you guys offer. And you're really just there for those preventive, immediate needs. If there's anything that surgery or a procedure that needs to happen, the DPC is going to be your quarterback. They're going to direct you to that standalone lab. They're going to take you to places where you're going to save a lot of money and still get the very same high quality health care that you would even in a hospital system. And then Zion Health is really the other piece of that puzzle. We're there for those large unexpected needs, cancer diagnosis, accident, surgery. We're going to be in place for that large unexpected need. So you're really going to have this complete healthcare package. And for employers even looking to save money, you're going to get so much value out of having a DPC and a health share combined together. So that would be the value for that together.
And just to add, as one other statement as well, is that our memberships, we have a special pricing that's available to DPC partners as well. So if you're a member of your DPC, you'll get a much better rate with Zion Health, because we know that you're getting the best care that you can get. And you're able to really save a lot of money from every perspective, from everyday care to larger medical expenses, and then of course your monthly payments that you pay to the communities.
Great. The next set of questions, this is the most asked. I meet a lot of people. I meet a lot of small business, and not many know about health sharing. And those who do, they are misinformed, or they have these confusion about how it works. And it's regarding the claims. And first of all, it is pre-existing. How do you guys treat pre-existing condition? And that's one of the most asked questions.
I'll take this one too. Pre-existing conditions, that is something that we're able to limit on how we share in. We accept everyone, so everyone is welcome to join us, but we want to make sure that it's a good fit. Somebody with several pre-existing conditions or pre-existing conditions with a lot of high costs, we're not going to be a good fit for them. And I'd rather tell you that right up front. They're going to have better, their needs are going to be met better on the marketplace or with other solutions, maybe a spouse's insurance fund that they can jump on. For us, though, pre-existing conditions, sometimes it makes sense. I had somebody talk to me a month ago or so, and they said, I have an asthma condition. Would that be considered pre-existing? And I said, it just depends on how that's going for you. She's like, well, I have an inhaler prescription, but I really don't have any major events that come across with this. And I said, this might make sense for you. The risk is really low. This might be a good fit for you to join us. So I'm just going to tell you how we do share in pre-existing conditions. For us, we're going to define that as anything with a sign, symptom, or treatment in the previous 24 months to enrollment. So the time they enroll, anything that's happened in that 24 months would be considered pre-existing with us. Now, we do have exceptions. So the All-American 3, right? Like high blood pressure, high cholesterol, and diabetes. So as long as those are well controlled, we haven't had a hospitalization in 12 months, we're going to have exceptions for those and not consider those pre-existing. So we have an RX share program that's going to go live 11 months. So we will be able to share in their maintenance medications with an Optum 3-tier drug program there. If it is pre-existing conditions, like I said, we just limit in how we share in those. So we do have a 1-year waiting period. If we have a pre-existing condition and a large medical event comes up because of that, we wouldn't share in that for the first year. And then we would share up to $25,000 in the second, up to $50,000 in the third, and up to $125,000 in the fourth, and capped at that same $125,000 for the following years. So it can make sense for a lot of people. If it's a low risk, this might make sense for them. But like I said, I'm going to be honest with you, a lot of pre-existing conditions, comorbidities, something with a high cost, we're not going to be a good fit for that. But we can be a good fit and a good solution for a relatively healthy population looking for something in place just for those large unexpected needs.
Great. Yeah, this will set a lot of questions.
I'll be happy to answer those. So
Yeah. The other one was the claims process. See, usually when you think of the sharing, it's people writing in checks. I mean, I think it started off that way, where they share in somebody's burden. And so I believe the process is now much more simple. Can you just give us a process of how you report the claim and what you do and how the money, how you give the money out to them? Can you go through that process?
Absolutely. You want me to take this one?
Sure. Whatever you like.
So perfect. So you're right. We have created a very simple model and a very simple solution, and keeping in line with that same heartfelt community sharing where we share in each other's needs. We don't ask our members to write checks for one another, but it does work similar. So what we do is we give our members an ID card. So once they join us, they have an ID card that has everything the provider needs to work with us directly. So they take that card, they show it to the provider. It does have that in-network logo if we're participating with an in-network provider. Not necessary, of course, but sometimes it helps providers feel a little bit more comfortable with us if health sharing is a new idea. We're still in that learning phase of learning how to shop for our own healthcare. So not everybody's familiar with us, but everything on that ID card to submit claims to us is on that ID card. So member takes that ID card to the provider has all information to work with us. If it's a large medical event, then they'll meet their IUA directly to the provider. So say, for instance, they have $1,000 IUA, then they would pay that directly to the provider. They would submit the receipt to us online. We have a submit needs portal where they'll start their needs process, and they'll submit that receipt to us. Then once we receive that confirmed payment, then we'll go ahead and work directly with their provider to share in the remainder of those medical expenses. So it really keeps it simple for the member, and that's how we wanted that to be.
Absolutely. So instead of kind of answering that question a little bit differently as well, is it instead of paying checks to each other and sending off to other members within the community, what's happening is that you're paying your monthly payment, and that money is going into a fund that will be sharing in those medical expenses with each other. So instead of sending checks to strangers and what have you, we're sharing with the community as well, and making it so that we can make it easy and accessible, and so that's part of the magic behind it.
So do you do all the negotiations just like the insurance would?
Absolutely. We work directly with that provider to negotiate those medical expenses, and as Heather was talking about earlier, we do like when we know about those conditions ahead of time and know what you're going into the hospital, because we can certainly work with them before you go into to get your service, and make it so that we can negotiate those medical expenses ahead. One of our favorite places, I mean, there's people who need surgeries all the time, and that's one of our common things that we share in as a community is surgeries that come up, and so we can, if we know about it ahead of time, we could help them locate a surgical center that's nearby, help get that negotiate the payment for the pricing, and then also the payment for those medical expenses.
Okay, and this one is there's a lot of fear about health sharing because people don't know, not many people know about health sharing. So there's a lot of fear mongering that health sharing does not pay claims. So what is your claims record? How do you pay claims? Is there any kind of issues paying claims? Because I want this out there for everybody to consider when they're looking into health sharing.
Yeah, that's a great question. We do a really good job with this, and this is something that Zion Health really prides itself as really setting a new standard in the industry. And you're right. When you're thinking of health shares, a lot of times the part of the fear mongering that happens, if you will, is that people feel like it takes forever to get something paid, and oftentimes they're paying directly with that. They're paying the provider and then submitting the bill to the health sharing community and waiting for a reimbursement, or they're waiting for the bill to be paid so that they could, or the money to be received so they could pay the doctor or the hospital or something. And that sometimes takes a while. That the average time is usually 100 days or more within the community, other communities out there. Zion Health does things a bit differently. We like to pay things quickly and efficiently. And so we're often paying for medical needs within about 5 business days. So big difference when it comes to how quickly we pay and process payments. And of course, that's besides also the fact that we pay for a lot of medical expenses before they even occur. So if we get ahead of things, that's better. If we that makes it easier for us as a community to be able to make sure that we control the costs and make it better for everybody. But to also that note, a lot of times in the when people talk about, hey, a health share didn't pay for this, it might be because of a need not being eligible for sharing, and there's a lot of Heather was talking about earlier the concept of pre-existing conditions. That's something that happens a lot. If it's not disclosed, or if it's something that's a condition that is not eligible because of a pre-existing condition, for example, then that's something that wouldn't be shared. So as long as you are a good fit for the community, being that you don't have a pre-existing condition, for example, that needs a lot of care, right from you join, and then the next day you're looking to get a surgery, is probably not necessarily the right fit. But if you're joining, you're relatively healthy, or if you have some minor conditions that you might need to that are okay to share in, for example, what mentioned, kind of referring to what Heather already mentioned, then that would be something that would be a good fit for the community, and you wouldn't really necessarily have problems with. So, yeah.
I just wanted to jump in. Like, our member care team is always on the phones. Please direct them to us. Ask those hard questions. Let their members know that if this is going to be a good fit. I work next to these guys all day, and they are always on the phones. They're always on the chalk feature. They'll take as long as they need to with you to make sure that you feel comfortable and that this is going to be the right fit for you. So behind the membership with us, you're going to have a great member care experience. So all the way from exploring us all the way through needs process, they're top notch, you guys.
Yeah.
So
Great.
Definitely.
Can I say, that we were probably the earliest, or if not the first TPC clinic that you guys started working with?
Yeah,
no.
absolutely. Yes, you guys you're on the map for that. So we appreciate working with your team, and also the trust in us, and working with us to help the members to have better healthcare. That's great.
We're honored to be part of this, you guys. Thanks for having us be part of this conversation. It means a lot to us, and to be able to be that.
This has been a wealth of information, just regarding the health sharing process, Zion Health. And, thanks, Nathan, Heather, for taking the time to join on this interview series. And we hope people out there get the information they need about health sharing plans and Zion Health in particular. If you have any other questions, please let us know, and we can contact Zion directly. We would love to answer all the questions, hear more from consumers.
Perfect.
Before we end, what is different about Zion Health Share than other health share companies? Why pick Zion?
Yeah, that's a great question, and there's a lot of ways that we can answer that one. And we've already kind of mentioned a few things. The fact that we answer the phones, and we're proactive, and our service levels are high. I think those are one thing that you could really be excited about working with us on. People love to have good service. Another thing is that we pay those medical expenses quickly, and so I like to just kind of frame it up as that we're a very more, I know everyone says this, but we truly believe that we reimagined what a member feels that they should have in a health sharing community. So you expect good service, you expect that the needs will be able to be shared quickly, and you expect that the community is there for you when you need it most. And that's what what makes us different. Because of the things that we do day in and day out, we're making sure our members have a better experience. And I know that if you join us, that you would have a better experience than anywhere else. So that's what sets us apart from the other health shares.
I would add that we're simple. You heard the 3 IUAs. We're easy to work with, and we have that fantastic member care team behind you. Well, I hear their conversations daily, and it's heartfelt. We care about our members. We want them to have the best needs, and we feel sad when it comes to be something that we can't share in. And we're always, we can't help you, but let us help you find a solution. And we always try to direct you to where you can get sharing. So it's just, I would say those things.
Absolutely,
sure.
I agree. Thank you so much again. Appreciate your time.
Thanks, Nathan, Heather.
Yes, thank you, Sunil. Thank you, Bhavana. We appreciate this opportunity.
Thank you.
Mhm.